Hello, I'm Angela Goodrich, owner and administrator here at Good Nursing and Medical Training. Welcome to the phlebotomy orientation. Today officially begins your phlebotomy class, and this is your orientation. We will go over your orientation with you in the class, but I just wanted to make sure that we caught you at the beginning of the phlebotomy class. Welcome to Good Nursing and Medical Training. We're delighted to have you, and thanks for selecting our school for the premier education in phlebotomy training. We have been running our phlebotomy program now for about 6 months, and we're doing great. Students have so far passed their national healthcare national exam, and we are very delighted that they have been successful. First of all, you will be given an enrollment agreement, your application and an enrollment agreement where you are actually signing up to attend the phlebotomy class. On that enrollment agreement, you will complete your name and your demographics, and you will place in there all pertinent information relating to you, especially your payments. The fact that you signed the enrollment agreement means that you are on board with our phlebotomy program and that you're going to complete and pay for and complete your program. You're also given a copy of the school's catalog here in the phlebotomy online program. Our phlebotomy program is a hybrid program. That is, part of the information is delivered online and part of the information is delivered in the classroom. So online, you will have a number of weeks of activity to do, week 1 through 7. And each week comprises of chapter readings, PowerPoints, videos, and then when you come into classroom in that week, you will review the content that you read, and you will also be given some skills, demonstrations, and you will do return demonstration of those skills in the classroom. That's where you will get your hands-on activity. So we have week 1 through 7 in the online classroom, and every week, a given week is to read your chapters. Might have 1 or 2 chapters to read, look at the PowerPoints, and then you will have some testing. After every chapter in the phlebotomy book, you will have a test. There's also a review assignment book where you will get to review the content that you learn in the chapter. So you have a workbook for your phlebotomy class as well. So those are the 2 textbooks that you should have. 1 textbook and 1 workbook for the phlebotomy class. And you have to have your textbooks in order to get through the class. You would have to have your textbooks from the very time you signed up. We sometimes have some books at the school, or we ask you to go get your own books. You can purchase them on Amazon. And as you sign up for the class, we will tell you what book or what edition you are using. So you will have chapters to read, you will have tests after each chapter, and then you will have your labs where you come into the school. Again, we will share with you the labs for the school. We will, for the week, we will go over those skills, we will show you those skills, and then you will spend the day doing a return demonstrations of those skills, okay? We will also monitor your homework, your test, and all that good stuff. Then you have week 2, you have week 3, and all of the weeks from 1 through week 7 is pretty much the same. You will have reading assignment, chapter test, and some labs all the way down. Now let's talk about the clinicals for this class. We expect you to get your clinicals, your lab sticks. This class requires 30 venipunctures and 10 dermal or capillary sticks. So you will have to get those sticks in class, and failing that, we're going to send you out to a clinical site where you get to put those practices in place so you can continue to secure your sticks. Part of the criteria for writing the NHA national exam is that you have 30 sticks, venipuncture sticks, and 10 dermal sticks. So we try to get you to do it here in class. Students stick each other, and students will also stick maybe the teacher or other students in the school who have given permission or who have signed that consent agreement that they will have their bloods drawn, or bloods, finger sticks or venipuncture sticks. So some students will participate in the process for you, and ever so often we'll have a workshop at the school where you can do your sticks there as well. So you have up to up to week 6, where you will be doing the reading of your chapters, your workbook assignment, and your labs. We do have clinicals in week 5, and we also have a clinical in week 6. And those dates were built in just in case you have to go out or if you're going to stay here at the school. Now, please note that the school also has a lab, and your sticks can be done here at the school. It is not uncommon if you have to stay here at the school simply because we do not have a clinical site set up for you. The school happens to have an official government acquired appointed lab space, and so you can do collection of urine, you can do finger stick blood sugars, you can do collection of a wound culture, different specimens you can collect here at the school. So we will try to get you to do all the specimens, all the sticks, all the capillary sticks here at the school. Failing that, we may have to solicit the help of a clinical site so you can get your other sticks. Now, in week 7, we will have you do the school final exam. It's just going to be a written exam. You will do that here at the school. And then also, you will have on week 7, you will have study guides, study materials for your national exam. That will all be presented in week 7. So in week 7, you'll still have some more time to do lab skills. You will have time to practice a little bit more. But the goal in week 7, the final week, is for you to do the school's final exam.